Welcome back to 3 Plus U. Well, I'm in my early 50s, as much as I hate to admit that, I am, and I'm worried about things like high blood pressure, cholesterol, and no better month to worry about it than now, although I guess we don't want to worry because that kind of doesn't help things at all, does it? But it is Cholesterol Awareness Month, and to help break down what you need to know about cholesterol, yeah, you do need to worry about it a little bit. We bring in Dr. Chelsea Ryan. She is a family medicine physician. She's with CHI Memorial Integrative Medicine Associates. That is up on Signal Mountain. And Doctor, welcome. We are so glad you're here. I am at that high-risk age, aren't I? Cholesterol. It's something I need to be concerned with.
Sure.
Yeah, sure. Yeah, maybe. Well, first of all, I mentioned cholesterol and high blood pressure in the same breath. Are they two completely separate issues, or do they play together in affecting the health of people middle-aged and higher typically?
Yeah, so cholesterol and blood pressure both play a role in certain risks for certain diseases, heart attacks, strokes, things like that. So definitely work together, yes.
So why do I care about high cholesterol? You mentioned that it can be a precursor to diseases and things of that nature. Is it something that do I need to have a cholesterol meter at home? What is high cholesterol? How do we get it? Is there good and bad cholesterol? What do we need to know about it?
Exactly. So cholesterol is a waxy substance, and it occurs in the body naturally and made by the liver. It helps make cells in your body, but you can also get it from foods that you eat. And like you mentioned, there is healthy cholesterol. That's our HDL, so you can remember H for healthy. And LDL is our lousy cholesterol or a bad cholesterol. And you also have triglycerides, which is one of the ways that our body stores excess energy. And so ideally, you want your HDL, your healthy cholesterol, higher, your LDL or your lousy cholesterol lower, and your triglycerides lower. And that type of situation is going to decrease your chances for heart attack, stroke, things like that, because the lousy cholesterol builds up in your vessels, making them more narrow, less flexible, which, like I said, can increase your risk for stroke and heart attack because it builds up in those vessels, especially the ones leading to the brain and those leading to the heart. You don't need a cholesterol meter at home. You can discuss with your doctor when that should be monitored and how often. So we usually recommend that the AHA recommends at 20 years old that you should start having some monitoring about years. And that can also be, the frequency can be increased or decreased based on your risk factors and also discussion with your family physician. So yeah, you can start at 20 years old, and but sometimes we check it in children because elevated cholesterol can also be inherited. That's called familial hypercholesterolemia. And that puts children at risk for heart attack and stroke. So knowing your family history, grandparents and parents who've had heart attacks, strokes, elevated cholesterol, that's going to be important to inform your pediatrician or family medicine doctor when you go for your child's well-child visits.
And you mentioned that the foods that you eat have a lot to do with it. And I'm assuming your body naturally makes the good cholesterol, and all the bad cholesterol is coming from the junk that we eat, right?
A lot of the bad cholesterol does come from the foods that you eat, but healthy cholesterol comes from the foods that you eat as well. So salmon, avocado, those have healthy cholesterol in it. So you really want to make sure that you're eating healthy fats and decreasing, saturated trans fats, things like that. Your fried foods, your processed things like that you really kind of want to cut down on.
And I've heard that, I know that there's, and I forget the name of the test, but there's a test that you can get concerning your heart where they can check either veins or arteries for plaque buildup. Is that plaque buildup, is that from the cholesterol, or is it a different thing that they're checking?
Sure. So that is from it's multifactorial. So family risk, so knowing your family history, how you live life based on exercise. Are you exercising? What are you eating? And that's called a calcium score. And that is an image that can look at the vessels of the heart and kind of determine how much buildup you have on those vessels of your heart. So you're right about that.
Yeah, and you mentioned exercise and being overweight. I mean, I'm assuming that being overweight is just bad for everything in general. It's not good for anything. But is the relationship from being overweight to cholesterol, is it just you're overweight because you've eaten bad foods, or is there another relationship to weight and cholesterol in the body?
Yeah, and so I think there's a misconception that if you're thin, you don't have elevated cholesterol, but that's certainly not always the case. Some people are, blessed with those genetics that they don't gain weight very easily, no matter what they eat. And those people can also have elevated cholesterol because maybe sometimes they're not looking at food labels or really concentrating on the amount that they're taking in. And sometimes I've had patients who look thin, and I am surprised at the cholesterol panels that come back. So yes, being overweight is a risk factor for elevated cholesterol, but certainly, body type is not, the only thing you look at.
Yeah, that is absolutely a myth, the idea of you have to be overweight to have high cholesterol. Are there any other myths that we need to know about, any other things that we misunderstand typically about high cholesterol?
So I think one of the things is that medicines are going to fix it all. Medicines certainly do not take away your unhealthy lifestyle, so it will help. So things like medicines like statins that you can talk to your family medicine doctor about helping with your cholesterol can certainly help decrease that lousy cholesterol. However, if you are eating very poorly and not exercising, a medicine can't take care of it all for you. So it's really, a multifactorial thing.
Well, Dr. Ryan, thank you so much. This is incredible, and I would recommend that people, you said 20 years of age. My goodness, I was not expecting you to say that young, but especially when you hit the middle ages like me, you absolutely want to start checking your cholesterol, definitely. Dr. Chelsea Ryan, family medicine physician, CHI Memorial Integrative Medicine Associates, thank you so much for being with us today.